Story of Success. I'm Rania Al-Azabi. Welcome to all our viewers around the world. Each time we'll be bringing compelling and inspiring profiles. Each and every story you tell gets us closer to people who have the power to bring in change and make a difference. Now, let's get started. Today, we're honoring one of Egypt's renowned names, both in medicine and photography. He started off his life joining the Faculty of Medicine, while ultimately leading a career into photography. He kind of put photography into medicine and medicine into photography. Let's study the man up close and see what he's doing right now. Dr. Mohammed El Deeb, welcome to Story of Success. I'll kickstart by asking you, why did you choose medicine as a career? Before the interview, you told me that you were following the path of your sister and uncle, and you were in the desire to help people.
First, my older sister, actually, she is a doctor, and my uncle is he is a physician, for the chest physician. And both of them, they encouraged me when I was studying that I want to be a doctor, as I saw that how much the message they are wanted to give to help the people and treat the people. So actually, I put this in my mind that I want to help the people. I want to make something good for them, and they continue their life and social life after accidents or after any disease, and also to prevent, because we have many habits or many wrong activities in our life that we can prevent them, and so we can prevent the disease from the occurrence.
You have quite well contributions to the specialty you were in. Give us some information about it.
About the photography?
Not photography, no, I'm talking about medicine. You have contributions in medicine. Tell us some information about the contributions you did in this specialty.
Actually, I'm an orthopedic surgeon, and after my graduation, I was choose this. It is one of the branches of the surgery. The surgery, it is technical, and it is neat and art, and the hands of the surgeons, of course, it is an artistic hand, which it is in his back of his ground, how he can create the operation, how he can prepare the operations, how he can post-operative can make a designing for the operation. And that's why I was chosen. I will be an orthopedic surgeon. I took this career in my study as a resident in one of the big hospitals here in Egypt, and then I took the MS orthopedic surgery, and then I did not stop for that. I was continuing to take an MD degree of orthopedic surgery.
What about your contributions outside Egypt?
The contribution in Egypt, actually, I like the research work.
Outside Egypt?
Outside Egypt, I was take many opportunity for the training abroad. Not only that when I was a medical student, but I take the opportunity also when I was a student in medical school. I went for England in the summer vacation. In the second year and the fourth year, because I'm like the painting, I visit many museums. And actually, I was directed by some of my colleagues and professors of the art. Please, Muhammad, you must visit these museums and make the background not only for the pharaonic history, Islamic history, Coptic history. You must see by your eyes what the world look and what are the modern schools of the art. And so actually I was visit many museums, whether this is a historical museums in England, in France, in Switzerland, beside my training. And when I was, after the graduation, I take an AO fellowship of Switzerland. I went for Basel in Switzerland. I went for St. Gallen. So during these visits, I was making photo exhibitions inside the hospitals. I make in the 4 big hospitals abroad, beside my training as an orthopedic surgeon, photo exhibitions. I was very successful because I was taking interlink between the people there, the different culture, and my culture as the Egyptian citizen.
Give us some information about the exhibitions that were organized in hospitals. What for and what results did they yield?
Of course, this is a very good question. And when I was starting to make this exhibition, it was a medical photography. And you know that, of course, there is a big link between the photography and our practice. We'll give this more details later. So actually, in our research or our documents, you need a good camera. You need a good documents. You can be a professor and you can be a very good researcher, but you cannot transport what you have for the people, for your colleagues. So this is a very important tool. And so I was start a medical photography in Stanmore in London, one of the royal hospitals in London. I made a medical photography, and beside that, there is just before me, there is another medical photography. I make a big research about the osteoarthritis of the knee and how they are used a microscopic photography for very close to the cells and all of that. So this was also helping me. Not beside that, a medical photography, I was used to transfer the peoples of the country which I was visit in Switzerland, in Marseille, in France. I was making Korea, South Korea in Seoul, and lastly in Kurgan in Russia. I was transfer all of my culture in my country to the people there. I was presenting myself as an ambassador to transfer Luxor, Aswan, our deserts, our folklore, and the people, they are very, very happy. And at the same, I was very happy. I'm feeling that I am not only doctor. Actually, during this photography, as you start your question, there is a big link between the photography and the medicine. And as you said that you have an orthopedic surgeons, we are using the camera not only for the arthroscope, for diagnosis, and also we are using the camera for the very advanced in the gait analysis, in the special analysis for the handicapped children and handicapped people. We are using special technology for using a camera, which it is an infrared camera. So actually, there are very good bridge between the orthopedic surgeons and my medicine and photography, which we are taking there. Both of them, they are enrich each other, and they give me in advanced steps.
A term that emerged as we were talking about the interview is photography art therapy. Would you give us some definition for this term?
Actually, there is many definitions about these items, photography art. There is what is called phototherapy. Phototherapy, it is the treatment by special colors of a lamp, which it is give special rays, and this is they are using also in the premature babies. And also there is what is called now a color therapy. Color therapy is a part of art therapy, which they can use the different colors for the helping and treating the schizophrenia, the depression, the mania, and all of that. So actually, the using the camera and photography as a part of the art therapy, it is now in the nowadays, and the beginning, the end of the last century, beginning of this 21 this century, they have using the new modalities of digital camera for taking a more advanced in health care of our patients in advanced diagnosis and advanced treatment. Not only of that, they are using for the treatment of the handicapped children and handicapped people. They are using for the drug abuse. They are using for enriching of the physiotherapy and rehabilitation. In last centers, when I was in Vienna, they are using the camera for sport medicine. And there is very advanced analysis for taking a very high models and diagnosis of the defects which is present in the muscles and the gait, because they are improving the physiques and improving the player to must have achieved a golden medal, why he did not have achieving all of this. So actually, nowadays, the photography, it is giving a much more advanced in medical service and increasing the total quality management, not only in the colors of the hospital, but putting the photography in big scales in the entrance of the hospital, in the entrance of the emergency room, in the entrance of the inpatient room.
Talk to us a little bit about your prizes and times you were honored outside and inside Egypt.
Actually, these prizes, it is a part medical and part it is...
No, we're talking medicine for the time being.
For medicine, I took the prizes from a medical syndicate. It is Yawm al-Tabib, it is the Doctor Day, and because I was making a combination of the doctor and keeping the art with me, and this was a big push for me that I must not leave one of them. There is some of my professor, Mohammed, please, if you want to concentrate on one part, but I never, because I find them, both of them, they are enriching each other. Not only that, I was continuing the MS degree and the MED degree. I took a very advanced researches in the spine surgery, and we are making this spine surgery with using special techniques, using the camera, video, and photography, which it has helped my researchers to take all of this degree in advance.
Half a century journey in the field of medicine, you must have faced a lot of challenges. Talk to us a little bit about it.
These actually challenges, I was break this at the end of my graduation. I took to the all my artwork to the art college in Zamalek. And at that time, I was not a photographer. I use photography just only in birthdays and in my family outside trips. And they are astonishing to me. And I put them in the corridor when they are evaluating. And they said, we cannot expect and medical students make all of this painting, because I made what's called optic art. Optic art is one of schools of modern art. And they said, Muhammad, please, this is Dr. Salah Naim. I was remember him at this day, and Dr. Taha Hussein is one of the big artists and professors. They are pushing me. You can start first lesson that you can take light and shadow. Take your camera and go there. At that time, I took my camera I went for Luxor and Aswan with trip with my colleagues. I took the first prize of medical college in 1978. I took the first prize of Cairo University. I took the second prize of all University of Egypt.
That takes me to ask you about those people who stood beside you and offered help.
Actually, there is many personnel. They are helping me to push me. Not only for my career in orthopedic surgery, there is many orthopedic professors. They are helping me because they know that I am a photographer. They are pushing me and they accept. They are pushing me and they said to me, Muhammad, you have using your photography and orthopedic surgery. Of course, you maybe have inventor. You may have created a new method for diagnosis or to help the handicapped people. So my professor, Dr. Hussein Abdel Fattah, Dr. Gamal Hosni, Dr. Mohammed Naziad, Dr. Daqorna, all of us, they are belong to Egyptian Orthopedic Association, who they are pushing me on that. Not only of that, also the artists or the big photographers like Dr. As I said that the artist, which is the art college, and Dr. Fariq Al-Arabi, when I was, because I am the general secretary of Egyptian Salon of Photography, and I was make a big activities. It is starting from 1992 here in Egypt for this Salon of Photography. So all the members, they are helping me and pushing me, and they know that I am orthopedic surgeon. So both of them, they are enriching each other. And also when I was abroad in France, England, Switzerland, they know that I am photographers. And I want to tell you that since 2 years, the professor of orthopedic surgeon in South Korea, in Seoul, he is a maestro of big orchestra in medical college in Seoul. And he was trained in the medical students in the Seoul Medical College there. And he is actually a genius and creative. And he know that I am a photographer, and he was presenting me in the university with the other professors who they are big artists, and they make each year a party for the music and a part for the art. So this is not something new and abroad. I know that there is many Egyptians doctors, they are like their art and they like their photography because we are enrich each other, and we are my message which I want to give the doctor who they know music or they know art or they know photography. Of course, he will diagnose his disease early. He will help his patient, and he will give him the treatment and encourage. When I was telling you, when I was in Korea and France, one of my first professor his name is Choi. He said, Muhammad, at the end of the last day, I want when you are check hand of your patient, look for his face. You will diagnose 50% of your disease, and you are putting your plan with his disease. This is which is called in Arabic ilm al-firasa. Actually, we did not study this is in our schools or our university. This is the key for, you know, what is the personnel in front of you. He has a depression, he has a mania. Before you are giving him treatment, you must study the psychology of your patient, the features of his face. So of course, as you told me, the photography, it has helped me the medical practice, and the medical practice, it has helped me in photography. As you said that there is a photography art therapy, which it is a very advanced now in the new century to help the handicapped people to improve the total quality management in our practice as orthopedic surgeon and as a doctor.
If we like to pause a minute to look at your experience in the field of medicine, we want to drive keys to success, in your point of view, of course. What are they? For you, what were the keys to success?
Actually, the key of my success, it is multi-keys. And the most important thing, you said to me in the beginning of our talk, challenges.
How many keys you have for success?
I have more keys. The first key is that I leave everything for Allah. And I was put myself that Allah subhanahu wa ta'ala, He was helping me because I have sincere in my work. I have sincerity in art and in medicine. So taking the challenges, as you said to me, it is very difficult. Some people, they say to me, one of two things, you will be an artist or you will be a doctor. Never, ever. I was continuing both of them till the end of the success, to the extremity of them, because I know that both of them helping each other. So this is very important. Second key, or I will tell you the case, that you evaluate your work, you evaluate your exhibitions, and I want to take the next step of the success. You have a good operation. How can I show this operation for my professors? Except I take this by photo, I take this by video. I was already saying to my professor, Muhammad, you go to this approach by this way. You must have this, you put your stools. So this is a way of language. This is the easy way of language, not here in Egypt, between me and the other centers of the others. The fifth thing, the third thing, the key that you must have a creative spirit. Creative spirit that you have a building what our colleagues done, and I want to put a new thing. I want to put an inviters or something new for what is already done, whatever this is in diagnosis or whatever this is in treatment.
Okay, now let me ask you to pass on some advice to the new doctors. What would you say?
I was telling advice for our new doctors who they are starting from their graduation when they are medical schools. And if you have an hobby of drawing or music or gymnastics or sport, don't leave it. Because I know the medical college is very hard. I know that there is many colleges very hard in studying like geometry or like commerce, like economic. I usually give advice for all the students, starting from their family, starting from the father and the mother, starting from their schools, starting from the universities, starting from sport clubs, starting from قصور الثقافة. All of this, they have a good rule for pushing the creativity in our new generation of our young peoples, who they can continue. We can find that a very good creative doctor. We can find also in Egypt an Egyptian creative engineer. We can find a very creative economics, because his personality is complete. He knows a very good religion, whatever Muslim or Coptic. He is like his family, like his colleagues, and he is enriching his hobby, and he will not drop it.
Final question before wrapping up. having sensations of a photographer, how did that play into your business as a physician?
Application of the photography in my medical practice, since of course firstly choosing your camera. You mean that usually I was telling to my...
What I mean is photographers are very sensitive. Of course, this should have affected you while dealing with patients. How did that play into your ability to deal with a patient?
This is very, very important thing which are usually, when my patients, they are, he came with his father and mother, and I made for him an operation. And he is taking physiotherapy and rehabilitation. I asked the mother to take by his mobile camera his exercises and his rehabilitation. And she showed him, my son, now your range of movement is not good because you must increase your range of movement. You are increasing your walk. Not only of that, I was also guide the family, which is the geriatric medicine, who they have bad habits in the houses, in the carpets. Please take shots because this is what's wrong. Also the computer and the computer misusing. It has drawbacks of health, of the neck pain and back pain and hand. We find now many young people, they are using iPad and they are using mobile. They say about 4 hours, 6 hours, they losing their health. So I was telling their mothers to take shots by the mobile to them and go to the internet and see the hazards of the sound sitting, making a good exercises, and they must not continue whatever this is a family or whatever in bank or in company. So using the sense of photography to give as a health education for my patients is very, very important to give an excellent health education and total quality management.
Obviously, he's big on both medicine and photography. We'll continue the path to success next time. Keep joining us.